Dr. Kristie. Today we are talking all things runner's knee, which is not the bee's knees at all. Now, runner's knee, you don't even have to be a runner to have runner's knee. You can be, but a lot of times it happens just from excessively bending that knee, and typically pain is kind of underneath that kneecap or even deep underneath that kneecap, and it's really kind of a smorgasbord of a diagnosis that can be, you might have heard it called patellofemoral syndrome, sometimes IT band syndrome goes along with that. So there's a lot that goes into this knee. So that being said, today we're actually going to cover the steps that you need to take to get rid of the most common causes of that knee pain. Now, with that being said too, there are other possibilities, right, for knee pain. So just make sure that if you're questioning anything, you get that checked out, right? Make sure it's not a meniscus or a ligament tear or any of those things. Other than that, we're going to get started with step one, which is actually loosening things up. Okay, step one is loosening all of the muscles around the knee that can lead into that pain in the kneecap. And oftentimes it's actually not right at the knee, it's these muscles in the hip coming down and the calf muscles coming up that surround the knee that cause the problem. So what we want to start with is getting some blood flow going first in those muscles. So I'm going to use the Derma Edge, which is actually a tool that I created and patented here in the US. And we're going to do a little test. So I'm going along my quads, I'm going to go along the hamstrings, and I'm going to go along the calves. And for once in my life, my calves are actually not that tight. So once you do this little assessment, you'll notice, and you can probably even see in this video right now, there will be some bumpiness. The areas that are bumpy are the areas that you actually really want to focus on. And I'm not putting a ton of pressure here. It's about a light to medium pressure, again, just to get blood flowing so the layers start to glide over one another. And sometimes even just that alone gets you to bend and be a can-can dancer too. From here, we're going to go on to doing some individual little trigger point releases in some of those spots that are even tighter. For the first two releases, you can use your knuckle, or I'm going to use this little edge of the Derma Edge because that's much more comfortable for me than using my knuckle in there. But we're going to get right up into the hip. So the glute medius is that first muscle. And if you find the top of that hip and drop down, that's when you're going to find that tender spot, okay? So you can kind of poke around. Once you do, there it is, you're going to kind of dig in there a little bit, and then you're going to take this leg and you're actually going to rotate it in and out. And you're going to go, ow, okay, ow, okay. And it's going to keep going like that until you go, oh, hey, that's not so bad. So you really are doing this until you feel a release. The second muscle is your tensor fasciae lata, long word, the TFL for short. And I call that your fifth pocket muscle, right? Because it kind of goes right here. Now this does a bunch of different things in the hip, but does attach into the IT band, right? Which is all the way down at the knee. So I'm going to take the edge again, dig it on in there, and this time, ooh, this one's sore. I am going to do a little march. Now if this is too much to do standing, especially because now I'm making you balance, you can do this one seated on a chair or even lying down by just bending that knee up. I just find this way to be the most effective. To release the quad muscle, right, the front of that thigh muscle, we're going to use our fluorescent tennis ball. So we're going to take that, and you want to find that tight spot on the quad. Mine's about right there. So this is where I'm going to lie on the tennis ball, directly on it. You can always do this in bed too if that's more comfortable for you. Because trust me, a hard floor sometimes is not quite the most comfortable thing in the whole wide world. Whew, breathe. Don't forget that part. Try to relax the rest of your body. Once you find that spot, you're going to take that bottom leg and you're going to come up and down. And I know I'm talking just normally here, but this one is a tough one for me. So again, you want to do this until it feels a little bit better, a little less sore. Next one is for the hamstring, using that tennis ball again. You're going to take and find again that sore spot wherever that is on the hamstring. Place that ball right underneath that leg. Same idea as with the quad, you're bending and straightening that knee, but obviously in a little bit of a different position, and you're doing this until it feels a little bit better. For the last muscle, the calf muscles, two of them, we're going to use the tennis ball again. This time, if you can get down on the ground, or again, long sitting on the bed, finding that tight spot, you're going to place that leg right over it. I usually cross the opposite leg so that the tennis ball doesn't go woo and slide away. And then you're going to add an ankle movement up and down. You can even go side to side. You can play around with that and see what feels better. And again, until that spot feels a little less tender. Okay, step 2 is mobilizing, or really moving those joints that get stuck. And the first one is that kneecap. Now that kneecap moves in all sorts of different directions, and it can get stuck, of course, in all sorts of different directions. So first thing you want to do is find the borders of that kneecap and really make sure that that leg is relaxed. That's important too. And again, you can do a little test. You're going to take, I usually take these 2 fingers and kind of push off to one side, push to the other side, push down, and push up. And you sometimes have to bend the knee a tiny bit to push up. Oftentimes it gets stuck going to the side. So if it does, you're gently pressing. You don't want any pain doing this. Once you get to your limit, you kind of stop there and add a little bit more push, 10 or 15 reps or so. So again, anywhere that you found that it was kind of stuck, that's the direction you want to go in, whether it's down, up, or to the side, and a couple times a day if you can for this one. Okay, the second joint is actually the ankle joint. A lot of times I see this one kind of get stuck, especially if you've had an ankle sprain, and then that really affects what's going on up here in the middle there. So if you have an assisted pull-up band, which is what I'm using, or you can use a belt or even like a yoga strap, you want something really heavy without a lot of give to it, but I love these assisted pull-up bands. I'll even link it below for you guys. But you're gonna take it, wrap it around something sturdy. I am going to put my ankle right in there. It's gonna go right towards the back of the ankle. I'm gonna step right away from that wall or post to get some good resistance. Keeping the heel down, you're gonna bend that knee and straighten. Bend and straighten, just like that. And then you'll go in the other direction too. So I'm gonna turn around, and now it's over, I'll do the other side so you guys can see me. It's right over the front of that ankle by those 2 ankle bones there. Same idea, pull out with some resistance, and then bending and straightening that knee. And you may even get a little pop, and that's okay. Step 3 is the fun part, the strengthening part. And generally what happens is these glute muscles, including the side glutes and the back glutes, hamstrings, and then just that general control of that knee are what tend to be weak. So we're gonna work on all of that with these next 4 exercises. If you have a band handy, go ahead and grab one. You might want it, you might not, but it's always good to have. So we're gonna start by putting that band above the knees. I'm gonna lie right on down on my back, heels together, toes open. Of course, breathing. We're gonna think about lifting that butt up, and after I get to the top, I'm gonna add a little pull out. So I'm working these side butt muscles even more, and then back down. So it's up, pull, back, and down. Really make sure you're squeezing into those bunsies and you don't let those hips drop. Exercise number 2 is on your side. Again, you can use a band or not, depending on where you're at. We're gonna go into a clamshell. So get yourself a nice alignment so that everything is nice and straight. Don't let those legs come too far forward or too far back. Usually it's too far forward. From here, step 1 would be just raising that top knee, keeping those bottom feet together. To make it a little harder, keep those feet together still, but now I'm rotating that bottom leg up, and now I'm lifting that top knee. And you'll notice the difference here for sure. Just like that, make sure you get both sides, that's important. And then lastly, propping on up, we're gonna go into a side plank. I'm gonna keep that band on, but as I lift up, I'm lifting now into that whole leg, coming back down, and I'm even gonna extend and reach that arm. Oh, this is so good. This now gets that hip flexor stretch too. So it's lift everything, come down, and stretch, right? Work hard, stretch good, just like that. Now we have one more exercise that's standing. For the last exercise, you need a stair or a 1980s Reebok step or even a phone book if you've got it. And I don't even know if those exist anymore. Something that's not super high, but that you can step up onto. So if it's my left leg doing the work, I'm gonna start actually with my left leg right up. Thinking about hinging a little bit back from that left hip, I'm gonna push back, I'm gonna tap that right foot down, trying to keep that knee nice and controlled. Gonna come up, woohoo, that was a little wobbly, and then I'm gonna tap down. Again, trying not to let that knee wobble in at all. You can pause in the middle if you need to, but you're going to keep repeating like that. The easier this gets, then you can go a little bit higher up on that step. Thank you so much for watching today. If you would like to support me as well as reduce some pain and get rid of the appearance of that cellulite, click the link below to order your own Derma Edge, a device that I created and patented when I was going through the middle of Lyme disease in a lot of pain and needed a way to work on my own body. So the shape of the Derma Edge allows you to get all body parts in a gentle way. We're getting that fluid moving in between the layers, which helps you move better, helps get rid of that pain, and decreases that bumpiness of the cellulite. So make sure to click the link below to order your own.